Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this video, we'll explore how to effectively approach these questions to increase your chances of selecting the correct answer. Let's delve into a scenario involving a patient undergoing a laminotomy with a partial facetectomy and excision of a herniated disc for cervical interspaces C3 to C4 and C5 to C6. We're tasked with determining the appropriate CPT procedure code and diagnosis code for this encounter. Here is the question. A patient receiving treatment at the hospital's outpatient surgery department had a laminotomy performed along with a partial facetectomy and removal of a herniated disc at the cervical interspaces C3, C4, and C5, C6. What CPT and ICD-10-CM codes will be reported? Here are the choices. Letter A, 63020, 63020, and M50.00. Letter B, 63020, 63035, M50.21 and M50.22. Letter C, 63040 and M50.20. And letter D, 63035 and M50.00. At this point, you may put the video on pause to give yourself time to solve the scenario. Once done, hit that play button to see if you managed to eliminate your way correctly to the right answer. Ready with your answer? Let's see if you managed to eliminate your way to the correct one. As always, we will take cue from the way that the question is phrased and how the answers are presented in coming up with the solution to this scenario. Take note, the question asks first what CPT and then which ICD codes will be reported. Additionally, the choices list the CPT codes ahead of the ICD codes. It would be remiss of us not to notice where the emphasis is being placed at, which at the same time also directs us on how to go about answering the question. We are to come up with the correct CPT codes first, and then the ICD codes, not the other way around. It may even be the case that sometimes you would not need to spend time looking for the correct ICD codes, because by working the CPT codes alone, you have already been led to a final choice. The first listed CPT codes have us choosing between 63020, 63035, and 63040. The codes in this part of the book can be divided into two groups, 63020 to 63035, and 63040 to 63044. Take a good look at the mother codes for each group, 63020 and 63040. And ask yourself, what word or words differentiate these two procedure codes? If you say the word re-exploration in code 63040, then you are absolutely right. Procedure codes 63020 to 63035 represent a first decompression attempt, while code 63040 to 63044 intimates that there has been a previous decompression procedure and that today's attempt is a subsequent one. In the narrative, we do not find the word re-exploration, nor can we find any word or words that would somehow hint that this is anything other than a first attempt. As such, letter C with code 63040 is eliminated first. This we could easily and immediately follow with a second elimination from among the remaining letter choices. Note that code 63035 is an add-on code. The instructions at the CPT manual's introduction pages tells us that add-on codes are always performed in addition to the primary service or procedure and must never be reported as a standalone. Thus, letter D with code 63035 is eliminated next. This leaves us with letter choices A and B, both of which have code 63020 as their first listed procedure code. We move to the second row of codes and from there, decide on which code best represents the procedure that was performed. In the narrative, two cervical interspaces were worked on, C3 to C4 and C5 to C6. While code 63020 indeed is used to report laminotomy with decompression on a single interspace, it can also be appreciated as laminotomy with decompression on the first interspace. The reason is that for each additional interspace, be it done on the cervical or lumbar region, the add-on code 63035 will be used to report that additional work, and never to repeat over either 63020 nor 63030. That being the case, letter A is last to go. The answer to this question is letter choice B. 63020, 63035, M50.21 and M50.22. By systematically evaluating each answer choice and eliminating those that do not align with the clinical scenario, we can increase our likelihood of selecting the correct codes in multiple-choice medical coding questions. We hope you were able to learn from this technique shared with you today. With much practice, this should become part of your strategy and bring you great results. Good luck on your upcoming medical coding exam.